So you're about to give birth. You've heard all about contractions, pushing, maybe even breathing techniques. But what actually happens right after the baby is out? What should you expect in the first hour, the first 24? And what should you pack for labor? The first hour after birth. Right after delivery, everything slows down, but also feels intense. You're holding this tiny new human, and your body is still in action. Your baby might be a little messy, covered in blood, or a creamy white layer called vernix. Totally normal. Then comes skin to skin. Your baby is placed on your bare chest. And if you watch closely, you might see them crawl. Yes, crawl. They slowly move toward your breast. It's called the breast crawl, and it's a natural reflex. This is usually when your first breastfeed happens. For me, it was special, but also difficult. My baby latched on, but it really hurt. I thought I was doing it wrong. Then a midwife showed me a trick. Squeeze your breast like a burger so your baby can grab more of the nipple and get a deeper latch. That made all the difference. And lanolin nipple cream? Lifesaver. I used it after every feed. It soothed the soreness and was completely safe. No need to wipe it off. Also, pre-made iced diapers? Amazing. If you've had a vaginal birth, they help with swelling and pain down there. And those big hospital underwear that fit adult diapers? Keep them. You'll bleed for days, and honestly, they're super practical. Time felt strange. I remember lying there, baby on my chest, just thinking, did that really happen? The first 24 hours? The first day is emotional. You might cry from joy, or from hormones, or because someone ate your snack. All valid. Your baby will want to feed. A lot. The first milk is called colostrum, thick, yellow, and full of good stuff. It's made in small amounts, but it's exactly what your baby needs. Your baby's stomach is tiny, but this early milk is the perfect match for it. They might feed every hour. Watch for little signs. Sucking hands. Turning head. Mouth open, looking for food. If breastfeeding is hard, ask for help. A midwife or a lactation consultant can change everything in minutes. Your baby will get checked too. They'll be weighed and measured. Head size, length, weight. These are tracked to make sure they're growing well. They'll also be tested for jaundice, a yellow tint in the skin or eyes. Both of my babies had it. It's common and usually goes away after a few days. Feeding helps clear it faster. Then there's the APGAR score, done at 1 and 5 minutes after birth. It checks your baby's breathing, heart rate, color, movement, and reflexes. A score of 7 or higher means they're doing great. It's just a quick way to see how they're adjusting. It doesn't say anything about their future health. Your baby's first poop will be black and sticky, called meconium. Then it turns green, then yellow. They should also pee at least once in the first 24 hours. They'll sleep a lot, up to 17 hours, but in short naps, usually 2 to 4 hours at a time. Just remember, always put them to sleep on their back, in a safe bed, no blankets or toys. They can hear your voice, and it calms them. Talk softly. Even if their vision is still blurry, they know it's you. All right, now that you know what those first hours are really like, let's make sure you're ready. Here's what I packed, and what I'll always pack again. This is your hospital bag checklist. Hospital bag checklist. For baby, 2 to 3 outfits, 2 in size 50, 1 in size 56. 3 muslin cloths. A few diapers, even if hospital provides them. 2 baby hats, 1 for birth, 1 for going home. 2 pairs of socks, warm sweater or jacket, sleeping bag or cozy outfit for the ride home. Blanket, baby duvet, and cover can stay in car. Nursing pillow can stay in car. Baby lift can stay in car. Car seat, must have. For mom, maternity card and ID, phone plus charger, birth plan if you have one, robe and soft clothes, outfit for going home, slippers and warm socks, 2 nursing bras, get 1 size up, nursing pads, big comfy underwear or mesh ones, heavy-duty maternity pads, big adult diapers, so helpful, lanolin nipple cream, helps with soreness, safe for baby, toiletries, toothbrush, toothpaste, face cream, lip balm, hair ties, 1 roll of soft toilet paper, towels you don't mind tossing, something to read or scroll through. For partner, phone plus charger, change of clothes, toiletries, book, magazine, snack manager mode. For both, water or juice, snacks, fruit, nuts, crackers, chocolate, sandwich, keep in fridge until go time, gum or mints. Giving birth is powerful, it's intense, and it's a little messy. But now you know what to expect and what to pack. Take it 1 moment at a time. Ask for help. Be kind to yourself. From one parent to another, you're doing better than you think. You've got this.